Okay, so welcome again. Now, the next topic in psychiatry emergency series is the psychiatric aspects of domestic violence, elderly abuse, child abuse, and rape. So, these are again the cases that you're going to see, maybe not as commonly as delirium or others, but you need to know how to understand these cases, how to manage these cases. So, I'm Dr. Saleha Mujawar, assistant professor, and I'll be teaching you about these cases. So, first, the psychological aspects of abuse. So understanding these scars are very, very important. So abuse can be in various forms, and any form of abuse leaves a deep psychological scar that can significantly impact mental health. So whether it is domestic violence, elderly abuse, child abuse, sexual assault, any of these trauma can lead to a range of mental health challenges which affects the individual across the lifespan. So not necessary that immediately they'll have consequences of the abuse. The abuse can have implications even after years. And this presentation will cover the psychiatric ramifications of abuse, the specific mental health conditions commonly associated with each form of abuse, and some insights into the therapeutic interventions available for recovery. In fact, if you want some reading, extra reading, there is a book called as Body Keeps Score. So that book discusses the mental trauma and how the mental trauma leads to physical symptoms also. So it's a very interesting. It's not a academic book. So I'm not telling you to read this for your exams, but if you're interested and if you want to read, it's a very interesting book. So first coming to domestic violence. So the impact of abuse of domestic violence. So it leads to depression, it leads to anxiety, it can cause PTSD also. PTSD is your post traumatic stress disorder. So, the constant fear and power imbalances in an abusive relationship can have devastating effects on mental well being and their day to day life. And seeking help and support is also very difficult for these kinds of patients. So, reaching out for help is a sign of strength. Therapists, support groups, legal resources, any of which can provide help to them, can help them heal from the trauma of abuse and rebuild a new life which is free from violence. So, like I've told you, it can lead to depression. So, domestic violence can lead to persistent sadness, low self esteem, feelings of worthlessness. Post traumatic stress disorder has a different presentation. So, exposure to violence can trigger PTSD. This is characterized by intrusive memories, nightmares, and avoidance behavior. Anxiety disorders can also occur secondary to domestic abuse. So, this is characterized by intense worry, panic attacks, and a fear of being alone. So, all these three things can arise from domestic violence. And depression, again, we've seen that yes, it leads to sadness, PTSD, anxiety, but substance use disorders can also occur. This is less common, especially in the Indian context. If the female has domestic abuse, it is very unlikely that she'll go into alcoholism or any addictions. So, less common, but yes, domestic violence can cause victims to turn to drugs or alcohol to cope with their trauma, and this can lead to addiction, it can lead to further complications. So always remember that yes, you're asking the patient about depression, PTSD, anxiety, but also ask if there is some substance abuse problem also. And what can we do as doctors? How can we help them in healing and recovery? So one important and most important thing is safety planning. So safety planning is vital for escaping domestic violence. So it involves creating a personalized plan to ensure safety during and after leaving an abusive relationship. So safety of the patient is very important. This plan should include practical strategies for escaping danger, securing resources and protecting oneself from further harm. So this is something which happens very commonly. So safety planning is important. Escape routes. So identifying escape routes and safe havens is a key. So having a plan for quickly and safely leaving, including designated exits, transportation is crucial. Legal protection is also very important. So seeking legal protection, like they might have a restraining order, so this will help create a barrier against the abuse. This can involve working with legal professionals to file for a legal protection, ensure that the abuser is held accountable, and safeguarding the victim's well-being. So these are the first things that you should do if you know that the patient has domestic violence. Apart from safety planning, from our side, we have something called as cognitive behavior therapy. So this therapy challenges distorted thoughts and beliefs influenced by abuse. Because of constant abuse, the way of their thinking or the way of looking at life actually changes. So CBT makes their thinking normal or makes their thinking actually different from what was there during the abusive period. There are trauma focused therapies also. So this therapy specifically focuses on trauma and how to develop coping strategies. Support groups are also present. So providing peer support and a sense of community actually helps the patient feels very better. If all these things are not working, we have medications also. So medications for anxiety, depression, insomnia. This is like the last step. If the patient needs it very necessarily, then only we give it. Now coming to elderly abuse. So elderly abuse actually is a hidden epidemic. We don't know the actual numbers, but it occurs very commonly. So elderly abuse can occur in various forms. So one is a physical abuse. So physical abuse involves use of force against an elder, causing physical injury to them, causing pain to them. It can include hitting them, slapping them, restraining them. So this is under physical abuse. Emotional abuse can also occur. So emotional abuse is a form of psychological treatment that aims to control them, manipulate them. So giving threats to them, intimidating them, verbal insults, all these come under psychological abuse or emotional abuse. There can be financial abuse also. So financial exploitation involves misusing or stealing their money, assets or properties. It can include forging signatures or coercing them, यानी उनको जबरदस्ती threaten करके या जबरदस्ती करके property lena, money lena. Sexual abuse can also occur. So it can have it can manifest in the form of non-consensual sexual contact with an older adult. It can range anything from unwanted touching to actual forced sexual acts. Neglect is also a form of abuse. So neglect occurs when the elder's basic needs are not met, like food or their housing or safety needs, leading to their harm and suffering. So failing to provide adequate water, food, shelter, medication, personal hygiene, this is also elderly abuse. Then exploitation. Exploitation means taking advantage of the older abused vulnerability for personal gains or forcing them into some illegal activities on their behalf. So this is elderly abuse. What are the psychiatric ramifications? Very similar to domestic abuse. It can lead to depression. So, elderly abuse can lead to depression marked by feelings of hopelessness and worthlessness. The abuse may trigger a sense of isolation and social withdrawal, making it difficult to enjoy their day to day life. PTSD can also occur. So, trauma of abuse can lead to PTSD, which can cause nightmares, flashbacks, avoidance behavior again. This can significantly impact their quality of life, making it difficult to cope and deal with their everyday stressors. So, anxiety can also occur. So, constant fear of further abuse. Victims may experience persistent worry, generalized anxiety disorder, panic attacks, and again, their sense of well being is impacted due to this. Now, coming to child abuse. So, one is what is trauma informed care. So if a child abuse patient comes to you, identifying them and treating them is a challenging thing. So trauma informed care is central to helping child survivors. This approach emphasizes understanding and addressing the child's trauma history while avoiding re-traumatization. So, child abuse patients are the most delicate and the most tricky patients to deal with. Sometimes play therapy helps in them. So, play therapy provides a safe space for children to express their emotions and experiences through play. Because as adults, we are able to express whatever things have gone wrong or whatever abuse is there, but children are not able to tell. So, through play, we can actually extract that information. And family therapy is very important. It addresses the dysfunctional family dynamics and aims to improve relationships, also creates a supportive environment for healing and growth of the child. So, child abuse, we don't want to accept it, but it is there very, very commonly. 1 in 7 children in the United States have some form of childhood abuse or neglect before the age of 18 years, and this is according to their National Child Abuse Helpline. So, this is very, very high if we look at it. So, the epidemiological point of view, a lot of cases are occurring. 80% of these cases will have long term effects. So, up to 80% of child abuse survivors suffer from at least one mental health issue as adults. So, this mental health issue can again be depression, anxiety, PTSD, substance abuse, and around 1500 deaths can occur from abuse and neglect. So this is a very serious condition. We need to treat this very, very effectively. So impact of abuse on child's mental health. So child abuse is a devastating reality, and it leaves permanent scar, emotional and psychological. So it encompasses a range of harmful behavior like physical, emotional, sexual abuse, neglect. And now we are going to see what mental health impacts are there and what interventions can occur. So again, PTSD can occur. PTSD again, the symptoms are same: flashback, nightmares, hyperarousal will state, emotional numbness, and these symptoms can significantly impair with their day-to-day life, making it challenging to cope with everyday situations, maintain healthy relationships. Specifically seen in child abuse cases are attachment disorders. So, abuse can disrupt the development of a secure attachment bond, leading to difficulties in forming healthy relationships with caregivers and peers. So, we have something called as a reactive attachment disorder. So, this is what is diagnosed in these patients, especially if they have marked difficulty trusting and connecting with others. So, attachment disorders are specifically seen in these patients. and sometimes they can have developmental delays also. So abuse can harm a child's development, impacting the ability to learn, control their feelings, build healthy relationships. So they can have delay in language skills, delay in social skills. Their schoolwork is also affected. So early intervention and support is very, very important. Sometimes their emotional regulation is impaired. So abused children often struggle to manage their emotions, experiencing anger, anxiety, or withdrawal. They may find it difficult to understand and respond to others' feeling, making social situations challenging. Also, self-esteem and identity. So abuse can damage because see, self-esteem is made during the childhood, mostly during the teenage part. And if abuse is occurring during that time, their self-esteem and identity is also impaired. They may internalize the negative beliefs about themselves, so they might not have confidence, they might have difficulty experiencing happiness. And of course, depression and anxiety are, as is seen with elderly and domestic abuse, even seen in abused children. So they will have feelings of sadness, worthlessness, fear, worry. These emotions can manifest as depression and anxiety, making it difficult again for engaging in day-to-day activities, experiencing joy, making healthy relationships. These children can have behavioral problems also. So sometimes the children might get aggressive, they might have oppositional defiance, withdrawal, and social isolation. So these behaviors are actually a coping mechanism for them. It helps them decrease the emotional pain and trauma, but we need to change these coping mechanisms to much healthier ones. They can have self harm and suicide also. So the overwhelming emotional pain from abuse can lead to some children engaging in self harm or suicidal thoughts and actions. It is crucial to recognize these signs, provide support, and also to prevent tragical outcomes. So this was the trauma-informed care in abused children that we've seen. So play therapy, family therapy is very, very important. Trauma-focused therapy, again, there is something called as cognitive processing therapy, CPT, and very specific to treatment of PTSD and specific to abuse patients is something called as EMDR. This is eye movement desensitization and reprocessing. So what is done is patient is asked to look at object, and they are made to move their eyes. And when their eyes are being moved, we ask them to tell about their trauma and to process their trauma. So this is found to be very, very effective for addressing trauma related symptoms like nightmares, flashbacks, avoidance behaviors. These therapies help children process traumatic experience and develop the coping skills. Then we have family therapy. So for children in foster care or adoption, family therapy can help build secure attachment with new caregivers. This type of therapy focuses on developing communication skills, establishing boundaries, and creating a sense of belonging. Supportive education is also very, very important because they're spending most of their time in schools. So educating teachers is very, very important. Educating caregivers, community members about the trauma informed care helps create a supportive environment for abused children. This ensures that they receive understanding and appropriate support in various settings. So this is what you can do in helping them heal as a treatment strategy. Now coming to the sexual abuse victims, or what can you do in cases of sexual abuse. So these patients will also have PTSD, depression, anxiety, as was seen with other abuse victims. So similar symptoms will be seen. But apart from that, they will also have, it will also impact their sexuality and identity. So they might have sexual dysfunction. So sexual assault can profoundly impact a survivor's ability to experience intimacy and pleasure. So they will have fear, anxiety, emotional numbness during the sexual encounters. These difficulties can stem directly from the trauma or some negative beliefs that have developed about sexuality as a result of the assault. So, extra problem which is seen is sexual dysfunction. Sometimes patient might present with dissociation also. So sexual assault can leave the survivors feeling disconnected from their bodies and emotions, and this response is called as dissociation. So dissociation can manifest in the form of detachment from reality, feeling numb to emotions, even experiencing a sense of observing oneself from the outside of their body. This detachment, while initially a coping mechanism, can make it difficult to process trauma and navigate the relationships. So again, this abnormal coping has to be replaced with a proper normal coping. Then self-harm and suicidal ideations are also very, very common in these patients. They can engage in self-harm as a just as a way to manage their overwhelming feelings. uh, but this is not a solution. This is again a very abnormal coping mechanisms. These suicidal thoughts can arise from the trauma, stemming from feelings of worthlessness, hopelessness. It is crucial to remember, you have to remind these patients that help is available. So reach out to a mental health professional, reach out to a support network. There are lots of help available, suicide helplines are available even in India. So teaching them that somebody is there to help them actually helps a lot. What are the other things that you can do? One is therapy. So therapy can help survivors process their trauma, manage symptoms like anxiety, depression, develop positive coping strategies. And trauma focused therapies like CPT, EMDR, these are also helpful. Then, not just therapy, in the community, a lot of support groups are there. So, they provide safe spaces for survivors to connect with others. So, how others dealt with the experiences, they share stories and they receive some validation from fellow survivors. That can be very, very empowering for them. Empowerment therapy is also there. So it helps survival rebuild a sense of control over their lives. This type of therapy focuses on usually self-care, setting boundaries, reclaiming their sense of self-worth. But yes, if nothing is helping, we have medications also. So medications like selective serotonin reuptake inhibitors, they can help manage symptoms, improve our overall self care, self being, and self worth. Working with mental health professionals is crucial to determine the appropriate treatment plan. So, usually, the psychiatrist or the mental health professional determines that what type of therapy should be given to the patient. So with this, we end this lecture. Again, if you have any doubts, if you have any questions, questions are welcome.